The Opioid Task Force of the Palm Beach County Medical Society meets with people like Julia to learn more about the growing problem of drug addiction in our community. 7 years ago, Julia struggled with substance abuse. She says it's important that doctors use the correct words when dealing with people with addiction.
And I was going into my first rehabilitation center for the first time at 21. And I remember one of the doctors saying to me, well, you're too young. You're too young to know if you have a problem like with addiction. But I do have a problem, and I'm here to get help.
Julia now helps out people currently struggling with addiction.
This is a disease, you know, there's no choice. I didn't want to get high. I was just like, I had to. It was the only way I could like live and function.
And during the COVID pandemic, the substance abuse epidemic is spiraling out of control. 93,000 people died across the United States in 2020 from drug overdoses. That includes 642 overdose deaths right here in Palm Beach County.
Good morning.
Hello, how are you doing there, Martha? To combat the problem, the task force also meets with doctors like Dr. Martha Rodriguez. Dr. Rodriguez is an internist, not even an addiction specialist, but like many doctors, she sees plenty of patients with opioid use disorder as part of her normal daily practice.
When you have addiction, we have a lot of bias that comes from both the patient and the physician and the community that we need to change because no one chooses to have an addiction.
Dr. Rodriguez says the Palm Beach County Medical Society has helped her grow as a physician when it comes to addiction.
So when you have educated people telling you educated processes and teaching you is really when you can grow. The ability to have these webinars and the education, that this consistent education has been incredible.
Dr. Rodriguez specifically credits the virtual workshops sponsored by the Opioids Task Force.
Wonderful question again.
The task force has also published magazine articles and produced podcasts. The task force has spoken out for a number of innovative approaches to fighting the epidemic. This includes advocating for the new Palm Beach County Syringe Exchange Program.
This is the Flash Bus, the Florida Access to Syringe and Health Services. So obviously somebody has used syringes, whether that's for substance use, diabetic purposes, they can come exchange those syringes for clean syringes.
Austin has been in recovery for 3.5 years. He encourages doctors to frame addiction as a medical illness.
If I could tell doctors one thing, it would be to not go in with any type of preconceived notion about who I am or who somebody else is. You know, based on their past, don't label somebody an addict for one reason or another, and change the way that you approach your treatment with them because of the way that you perceive them.
In the end, what drives our task force every day are the stories of losses in our community.
You can see that the love is fierce.
Boca Raton's Cindy Singer has made it her life mission to prevent others from experiencing the heartbreak she experienced when her son Rory died from an overdose in 2015.
I have to put purpose to my pain.
Cindy co-created a nonprofit organization dedicated to helping people in recovery from substance abuse. And she appreciates the work of the task force.
Doctors are very important because they really are pillars of society. They impart a lot of wisdom. They should know about drugs and the impact of drugs.
There's no simple fix for the opioid epidemic. There's a lot more work to be done. But with an emphasis on the underlying message that addiction is not a moral failing, it's a treatable medical illness, I'm optimistic that our Medical Society Task Force can make a measurable difference. For more information about the Palm Beach County Medical Society's Opioid Task Force, visit our website at pbcms.org or visit facebook.com/Palm Beach County Medical Society.